Started.
Hello, everyone. Today, our group will be presenting nationwide nursing and primary care provider shortages. This issue affects hospitals, clinics, and patients across the entire United States, and it plays a huge role in the quality of care people receive. Our goal in this presentation is to explain what is causing the shortage, how it affects patients and healthcare workers, and what organizations like the AACN and leaders such as Dr. Deborah Trotman are doing to help. We will also share another perspective to show that the problem is more complex than it seems.
This slide gives a basic overview of how shortage began and why it continues today. Nursing and primary care physician shortages have been a problem since 1990s, but the COVID-19 pandemic made everything worse. During the pandemic, staff left the workforce faster than the schools could replace them. Issues like burnout, dissatisfaction, limited training spots, and overwhelmed healthcare system increased the strain. We also see the effect in education. The schools do not have enough faculty or clinical sites to train new nurses. As the burnout worsens, experienced workers retire early, switch careers entirely. This leads to the real consequences like declining quality of care, as noted by colleagues. Overall, the shortage has been building for decades, and now we're finally seeing its full impact.
So why are we facing a healthcare workforce shortage? A big issue is burnout and stress. Nurses and primary care providers are carrying heavy workloads, long hours, and emotional fatigue. Low pay and limited benefits also play a big role in rural and underserved areas. Even when the work is meaningful, if the compensation is low, it's hard to attract and keep staff. Another challenge is an aging workforce. Many experienced nurses and providers are nearing retirement, which leaves big gaps that are hard to fill. Training programs aren't keeping up either. There simply aren't enough nursing spots or medical residencies to meet the demand. Administrative burden also takes a toll. When staff spends more time on paperwork than with patients, it adds more frustration and stress. All of these factors combined are straining the system. So, how does this shortage affect healthcare workers and patients? For patients, it often means longer wait times for appointments and procedures. And when providers are rushed, the quality of care can suffer. With higher turnover rates, it destabilizes teams and adds extra costs for training new staff. Stress level increases, and unfortunately, higher stress can lead to more errors. Another major impact is having access to care. Rural and low-income communities are hit the hardest, widening the gap in healthcare or in health disparities. Basically, the shortage creates the ripple effect that affects everyone. Looking at these numbers, it really puts the problem into perspective. The U.S. could be as short as many as 450,000 nurses by 2025, and nearly 100 million Americans live in areas with the primary care shortage. Burnout is widespread too. 62% of nurses and more than half of primary care providers report significant burnout. Looking ahead, by 2034, we see a shortage up to 124,000 physicians across all specialties. Turnover, turnover is another costly issue. The average nurse turnover rate is 27%, which can cost hospitals up to 9 million annually. So when we add it all up, the shortage doesn't just affect staff, it impacts patient care, the stability of healthcare teams, and even financial health of hospitals. It's a problem that affects the system at every level.
The AACN plays a major national role in responding to the shortage. The organization provides nursing schools the standards and guidance they need to educate future nurses. They follow a strategic plan built around their vision, transformation of healthcare and health equity for all, their mission, lead and champion excellency and innovation in nursing education, research and practice, and values such as excellence, diversity, and so on. The primary membership within the AACN includes institutional membership, a partnership with educational institutions that offer baccalaureate or higher degree nursing programs. Furthermore, the AACN advocates for funding that supports nursing schools, such as grants for faculty hiring, simulation labs, and clinical training sites. Their work is essential because many schools often turn away qualified applicants simply because they do not have enough faculty. The AACN serves as the national voice for academic nursing and pushes for policy changes that strengthen nursing education. Without their leadership, schools will not have the support needed to train enough nurses to meet demand. The Dr. Deborah Troutman is the president and CEO of the AACN and has been a strong proponent in addressing the shortage. She has had extensive prior leadership roles and experience, such as serving as the executive director of the Center for Health Policy and Health Transformation at Johns Hopkins Medical Institution and the University of Pittsburgh Medical Centers. Her work has a heavy focus on advocacy, working with Congress, nursing schools, and healthcare organizations to secure and support academic nursing. Some policies she has supported including Stop Nurse Shortages Act, which aimed to expand nursing program capacity, as well as pushed against cuts for federal funding that would harm nursing institutions and reduce training opportunities for their students. Dr. Droutman's leadership acts as a bridge to bridge the gap between the academic world, the healthcare system, and the government, ensuring that nursing education is still a national priority.
The qualities that make Dr. Troutman an effective leader are showing strong commitment by advocating for greater investment in the nursing workforce and addressing the long-term challenges nurses face. Her emotional intelligence is clear in how she acknowledges the impact of stress and burnout and promotes policies that support mental health and work-life balance. Strong communication skills allow her to collaborate with Congress, academic leaders, and healthcare organizations to advance solutions like the Stop Nurse Shortages Act. One area for improvement is expanding collaboration with community colleges and hospital systems to increase clinical training sites and create more flexible pathways for nursing students.
This slide shows that the workforce shortage has multiple causes. Burnout can come from poor workflow design, limited autonomy, or weak leadership, not only in heavy workloads. Workplace culture also strongly influences whether providers stay. While pay matters, a study shows that a supportive team, good leadership, and growth opportunities often matter more than salary. The aging workforce can actually be an asset. Experienced clinicians can mentor young staff or work in flexible roles like telehealth. Technology such as telehealth, automation, and AI can ease the workload, but cannot replace the human skills needed in patient care. Overall, this slide highlights and solving the shortage requires addressing structural, cultural, and technological factors together.
Here is our proposed solution to address the nationwide nursing shortage. The shortage is driven by multiple factors, including burnout, low pay, limited education capacity, and an aging workforce. So the solution needs to target several areas at once. First, increasing nursing salaries by 50% would help retain current nurses by making the profession more competitive and reducing turnover caused by a low compensation. Second, expanding funded nursing education programs would allow schools to take in more students by increasing clinical placements, scholarships, and overall capacity. This ensures more nurses can enter the workforce each year. Improving working conditions is also essential. Lower nurse-to-patient ratios and adding more support staff reduce burnout and create a healthier work environment. Another part of the solution focuses on the aging nursing workforce. By offering paid training pathways into roles like leadership, education, or telehealth, experienced nurses can remain in the field longer without the physical demands of bedside care. Finally, these strategies align with the AACN's policy recommendations, which advocate for nationwide workforce and education reforms. Together, these steps address both retention and recruitment, making this a comprehensive and realistic solution to the nursing shortage.
These slides hold the references used throughout the presentation. They include research studies, national associations, and federal data sources that support the statistics and information we shared. Thank you.